Hey everyone, today we're doing our second video in the thyroid series, and we're not going to talk about thyroid physiology as much like we did last time. We're going to talk about one of the big problems that goes wrong, and this is going to be more of a thyroid hormone metabolism problem, not necessarily a problem with the thyroid itself. We're going to be talking about thyroid hormone underconversion today, so you'll see in a second what that's all about. We're going to start by reviewing a little bit of what we did in the last video with thyroid hormone production and metabolism. First of all, understand the brain interacts with your hypothalamus gland. That produces something called TRH. TRH tells the pituitary to make TSH, that's thyroid stimulating hormone. That stimulates the thyroid, as its name says, to produce T4. Now, when the thyroid produces T4, it uses an enzyme called the thyroid peroxidase enzyme. And that takes a tyrosine and 4 iodines, puts them together, and you have T4. So pretty simple there. T4 goes out to the body, and the thyroid also produces a small amount of T3. For what we're talking about today, it's pretty much a nominal amount. It's not enough to do what you need done, but technically it does produce, I think, about 6 or 7% of the T3 that your body has. But T4 goes out to the tissues and gets converted to T3. Now, remember, T4 is inactive thyroid hormone. T3 is active thyroid hormone. That's what does the job. Now, in order to convert from T4 to T3, you have to use an enzyme called the 5' deiodinase enzyme. And it's named that because it takes off one of the iodines to turn T4 into T3. Now, about 60% of the T3 that you're going to make gets done in the liver. About 20% of T4 that switches to T3 actually gets switched to something called reverse T3, which is completely inactive. It's gone. You're not going to get it back. And then another 20% gets converted to different types of T3 that are turned into active T3 by the bacteria in the intestinal tract. Okay, so that plays a role in the conversion as well. So we've got 3 different things going on with the overall conversion. And then T3, once it's finally made, has all of the attributes that are normally thought of as being things that thyroid hormone does. Okay, so that's your review of thyroid hormone physiology. Now, what is underconversion? Well, we just talked about T4 converting into T3. If that doesn't happen at a rate that matches what your body needs metabolically, then you're underconverting. Now, because T3 has all the effects of thyroid hormone and T4 basically has none, if you don't convert well, your T3 levels are going to be low, and you're going to feel like you're hypothyroid. But because your T4 levels are probably normal, everything looks fine on a lab test. So, how does this happen, right? How does one become an underconverter? Well, first of all, you can have a deficiency of cofactors. Any enzyme in the body that does work and has a particular function requires certain cofactors, certain nutrients that allow it to do its job. Just like if you were going to take trash out of your house, right? You not only need to be able to grab the trash, but you have to have a trash bag to put it in. If you're cleaning out your house and you're grabbing up all the trash and you have no trash bags, no trash cans, nothing to put it in, well, that doesn't do you a whole lot of good, right? You're just shoving it back and forth around the house. So cofactors, think of them kind of like the trash bags. You can do some work, but without the cofactor there, you can't finish the job. Okay, so you can have a deficiency of cofactors. That's generally a nutritional problem. You can have dysbiosis. Now, that's having the wrong bacteria in the gut. Remember, we said 20% of the conversion that happens from T4 to T3 happens in conjunction with having the right bacteria in the intestinal tract. If you don't have the right bacteria in there and too much yeast or fungus in there, you can build up things called lipopolysaccharides. And those are neat little compounds, but when they get into your system, they can slow the action of that 5' deiodinase enzyme, and they keep you from converting T4 into active T3. And that slows down that conversion rate, makes you an underconverter. You can have elevated cytokines. Now, cytokines are chemical messengers that come from our inflammatory response. If you remember in the video, The Physiology of Fat, I'm sure you all watched it and loved it and took notes. But if you remember in that video, we talked about TNF-alpha and interleukin-6. Those are cytokines. Those actually are made by your fat tissue, but those, along with a few others that are produced as part of a regular inflammatory response, can slow that rate of conversion from T4 to T3. Now, that's a little I don't know, it just makes the situation worse when you're overweight. Because the bigger you get, the more adipose tissue you're carrying, the more inflammatory cytokines you make, the more you slow your conversion from T4 to T3, the harder it is to lose the weight. Right? We have those cycles that develop in us when we get unhealthy. That's one of them. Elevated cortisol. If you watched our series on adrenal health, you know what cortisol is. It's a hormone that's released from the adrenal glands in response to stress. Cortisol does all kinds of strange things to thyroid metabolism, but one of them is it slows the conversion from T4 to T3. It slows that enzyme's actions. You can have a deficiency or imbalance in peripheral neurotransmitters like serotonin and dopamine. Now, we know that they do things in the brain, but they also have actions outside the brain. And one of those actions is to aid in the conversion of T4 to T3. So if you don't have the right balance of neurotransmitters, conversion slows down, you're an underconverter. Abnormalities in binding globulins. Understand that as these thyroid hormones move around the body, particularly T4 as it moves around the body, all but about, 0.5% of it is bound to protein and is unavailable to convert to T3. If you end up with too many binding globulins, you bind even more of it than that, and it's not available to convert. If you have too few binding globulins, as in pretty commonly in patients with polycystic ovarian syndrome, when women get too much testosterone, or what we call an androgen dominance, they end up not binding the T4 enough. They overconvert to T3. Seems like it wouldn't be too bad of a deal, but very quickly your T3 receptors become insensitive to that. They become resistant to that. And basically you still have all the symptoms of hypothyroid. If you have too much or too little T3, you can end up with the symptoms of not having enough. Because if you have too much, you overwhelm the receptors, they quit listening, and now the T3 doesn't do anything. So while you have enough, it doesn't work. So those are some of the situations that can cause you to be an underconverter and have normal lab work, but feel like you have a thyroid problem. So how does it look on your labs? I'm not going to go through all the thyroid lab tests that we do. There are between 7 and 9 of them, depending on the patient, that we normally look at in a full thyroid panel. But TSH will look normal if you're an underconverter, if you're only an underconverter. Some people have more than one issue. But TSH is going to look normal. T4 is generally normal, but you'll have a low T3 or a low free T3, and you'll have all the symptoms of hypothyroid, or at least a sizable number of them. So let's review those for a second. Cold hands and feet, poor circulation, fatigue, depression, dry skin, constipation, hair falling out, weak nails. All of those are symptoms of hypothyroid or not enough thyroid hormone, whether the thyroid's actually doing the job it's supposed to do or not. So that gives you a little bit of insight into underconversion, and I want you to really understand why sometimes your lab tests look perfectly normal, but you feel like you still have a serious thyroid problem. You probably do. It's a thyroid hormone metabolism problem. The thyroid may well be just fine. So what do we do about all this? Well, as you're used to hearing me say in functional medicine, we have to fix the underlying problem. That whole list of things I gave you as to why you might be underconverting, each one of those has to be dealt with. And we work through the list one by one, and we clear out all those problems and hopefully restore your ability to convert. Now, that also means that if you're taking a T4 medication, you can still be an underconverter, and your TSH and T4 look fine, but you're not turning that T4 into T3, and you don't get the benefits of taking the medication. Some people, when they switch to a medication that's a combination of T4 and T3, feel considerably better because they're underconverters. If we get you converting appropriately, you might not need as much thyroid hormone, or the medication you're taking might do the job you thought it was going to do in the first place. So understand, even if you're already taking medication, you need to find out if you're converting that into the active form. Most of the medications out there do not include T3. They are just T4 medication. So we fix the underlying dysfunction. If we need to talk to your prescribing doctor about altering your medication a little bit, we can do that as well. But once we get you properly converting and not underconverting, a lot of times the symptoms of thyroid dysfunction just kind of disappear. So if you feel like you're not well managed, if you wonder if maybe you're an underconverter, if you haven't had a good thyroid panel drawn, pop in and see us, let us know, we'll get you taken care of. If you're out of town, find a functional medicine practitioner near you. So that's it for today on underconversion. We're going to go into a couple more thyroid videos coming up soon with some of the other problems that happen. But for now, I appreciate you watching. I'll see you on the next video.